داخل بيوتهم وقتلوا جميع من الأطفال والناس الكبار والزول داخل البيت.
وصلنا هنا إلا بيومين وبقى لنا أسر شديد في الشارع.
There are many old people, dead people, people can't find the medicine. Just no money to go to the doctors.
When this crisis happened in April, ALIMA, within 48 hours, we were able to activate our rapid response team to respond to this emergency in Tawila, Umda. Within less than 10 days, we have an influx of over 450,000 people from Zamzam that were displaced. And this is something that I will live to remember. I have never seen such a massive displacement within a short period of time.
We provided emergency intervention for the wounded cases, and also we did health promotions for the community. We organized emergency intervention in malnutrition because all the children were in Zamzam. They were in siege for more than 5 months. They cut all the supply and they were starved, in addition to the road suffering when they came, and they really wasted. So within 3 weeks, we did admission more than 500 children in severe malnutrition programs. We did more than 3,000 consultation per month, like average consultation per day was 250 to 300 patients per day.
The population is actually so traumatized. Almost every other person has a mental need because number one, we have the IDPs, we have the host community who are actually now hosting these IDPs, and we also have our staff who are taking care of these patients who are coming in from this population within Tawila.
The major logistic difficulties that we're facing, the main challenges is the road. We had a truck loaded drugs to come to Tawila, and they loaded in 5 December 2024 from N'Djamena, and we received here in February 12, almost two months to 3. The road is very tough. The second is the suppliers. Now the suppliers, instead of the conflict which is taking place in Al-Fasha, price rising, dramatically because there is no control. Imagine like the bottle of water here is a 3K, whereas before it was 1,500. So fuel last time it was 1 jerrycan is like 60,000, and now it's almost 180,000.
"70 to 80% of ALIMA staff currently working are people with PICs from various camps, and these people have different stories because have been displaced. This is like the 6th or 7th time. Most of them have gone out and come back, gone out and come back over time, and that gives them the resilience to stand in to work with ALIMA to provide these services for their host communities, because this is the only thing they can be able to do to give back. ALIMA is working with the Ministry of Health to be able to have a qualified manpower to be able to work with. And also the people we have sourced from the MOH, ALIMA is providing for them on-the-job technical assistance with the view to be strengthening the health system. This is very important for us as ALIMA. Our trademark is to strengthen the institution, build capacities of the locals so that they can be able to take over from us whenever we exited.
On daily basis now, they can more than 100 to 150 family household per day, and so we expect that Tawila will receive as a wave of the displacement because of hunger, and we are afraid that during the rainy season, the supply to the area will be a little bit limited, even the medicine supply, nutrition supply, most likely the malnutrition will increase. First of all, the priority for the malnutrition programs, they need to be supported well. The stock for malnutrition children need to be guaranteed for the rainy season. Secondly, awareness and health promotion activities in the communities need to be a little bit activated and be supported by the NGOs, so at least they can able to respond in case of any epidemics.
As we can see, the first rain is fast approaching and they don't have even shelter, adequate shelter that they can cover. And this is a very huge crisis awaiting us, because once the rain started, these people are exposed again to danger. And we cannot take away the anticipation of a wave of pandemic of cholera.
Also, we see that there is not enough funds to carry on these activities. There is a need to scale up. Apart from the primary health care, there is a need for secondary health care. We need to have some stabilization center for severe malnutrition, and we need also to have some BMONG. When we talk about the BMONG, these delivering rooms where pregnant moms they can deliver, supported by qualified midwives. We need to scale up on this.